Let's talk healthcare. The Centers for Disease Control and Prevention indicates that more than 8% of Americans, 27 million people, lacked health insurance at the beginning of 2024. That number is expected to increase as protections linked to the pandemic end. What is your plan to help those without health insurance, and how will you protect those with pre-existing conditions? Mr. Schiff.
My wife and I had the experience that all too many families have of our daughter coming into a room in the middle of the night bleeding, and we had to rush her to a hospital. She was fine. She got treatment. She was fine. Too many families, though, in California and around the country don't have access to that kind of good, immediate, quality health care. I think we should make Medicare available for all who want to participate in it. Folks who don't want to participate shouldn't have to, but those who want to should have that opportunity. What's more, we should continue to negotiate down the price of medicine through Medicare negotiations. I'm going to fight to strengthen Medicare and Social Security. Mr. Garvey says we should, quote, cut these entitlements. That means cutting Medicare for seniors, cutting Social Security for seniors, these incredibly important health care and anti-poverty programs. That's not where Californians are. That's not where I am. My father passed away at 96 this year. He relied on Medicare. He relied on Social Security. He relied on VA health care. I want to make sure that's strong for future generations.
Mr. Garvey.
Let's make sure that we have a vivid and strong Medi-Cal and Medicaid and an expanded Medicare. I think that's where all this starts. Let's not do away with competition between healthcare companies. I'm on several boards that deal with healthcare. Again, we got to get back in to this competitive nature of these United States. Regulations have constrained people competing against each other, and we become stagnant. Let's get back to free market capitalization, where these insurance companies, or I'm sorry, healthcare companies can compete for lower prices so it'll benefit all the people.
Can healthcare companies not compete now?
They've been restrained by regulations, and I think that's one of the problems with where we are in America right now is we need to deregulate. Once this administration took over the first day, you saw a significant amount of regulation at all the key areas that affect our lives.
A quick question for both of you. There's
some... respond to the last one, because I was puzzled to hear Mr. Garvey say he was supporting expanding Medicare. Because earlier in the campaign, Mr. Garvey, you said you wanted to, quote, cut these entitlements. What entitlements were you saying we should cut, if not Medicare and Social Security?
Where are you getting your information?
From you, Mr. Garvey.
No, not from me.
When this campaign
started, that first day I announced, you came out with a snarky remark that, oh, he was born on third base, meaning that I came from a wealthy family. Well, let me tell you, let me finish. This is going to be about how you disparage my mother, a hardworking woman who got up every day and took 2 buses to go to work, came home and took care of her son and her husband, who she helped get out the door, being a Greyhound bus driver and an invalid mother. So this is what you do. You lie
nothing but the kind
constantly.
of things to say about your mother.
Let's just face it. This is who you are, and this is what you do.
We're talking about your wanting to cut entitlements.
all right. I think we're getting a little far afield here. Let's continue.